Hello, this is Dr. Helen Webberley. Welcome to our GenderGP podcast, where we will be discussing some of the issues affecting the trans and non-binary community in the world today, together with my co-host, Marianne Oakes, a trans woman herself, and our head of therapies. We're going to talk today about what it means to be transgender in today's world, in 2018 and beyond. And I suppose, that leads us on to the first kind of concept, really. Marianne, help me out. How many gender identities can there possibly be? Someone said to me a while ago, there are infinite gender identities. And I was telling my son that, and he said, Mum, if you ever say that publicly, you're going to have it ripped out of you, kind of thing. And, is it true? Can we have an infinite number of gender identities? What does it mean?
Personally, I think the simple answer to that is yes. And the only reason I would say that is I had gender explained to me really simply by one of my clients, actually, in the therapy room. And they were explaining to the dad, who was really struggling to deal with the concept of non-binary. Poor dad's there. He sees the world as men, women, boys, girls, and he's got his child there trying to explain that, actually, Dad, I'm not a girl. I said, imagine that, men are black and women are white. They said to the dad, actually, I'm a funny colour grey. I'm not quite, one or the other. And I just thought, we are all shades of grey along that spectrum. And actually, if we were to divide that spectrum up into finite segments, then yes, there's going to be an infinite amount of gender identities. I'm not sure there's an infinite amount of ways to describe those identities, and that would be a different subject altogether. But I think even if you see what we may term a cis woman, we could look, is she wearing more masculine clothes or is she wearing more feminine clothes? What shade of grey would she be? Likewise, for a cisgendered man, what does it even mean to be a man? What does masculinity even mean? So yes, I think there is an infinite amount of gender identities. Is there an infinite amount of words to describe it? I'm not sure.
I love that concept. Brilliant. And actually, if you think about it, that colour of grey that you talked about there so eloquently, brought in by your client in the therapy room, when the cloud goes in or the sun goes behind the clouds, that shade of grey changes a little bit, which means that, whatever shade of grey that you are on the spectrum, it can also change with the day, with the month, with the feeling, with the level of support that you have. So, it is not a static place on that spectrum. I wish we could have a bit more colour. I'm not sure I'm liking that whole greyness. I'm preferring a kind of a rainbow colour to our infinite number of gender identities on the spectrum. So let's fill in a bit of colour and make that greyness happy. But I totally agree with you. So it brings us on to another kind of concept that we often meet, which is, can external influences in some way dictate what gender you are? So if, for example, you're supporting your husband, wife, partner to be transgender, allowing them to express themselves through clothes or makeup or hair, are you encouraging them in some way? Are you in some way making this worse, in inverted commas, for them? Are we influencing them or are we supporting them? And on a similar vein, can we possibly kind of iron this out? And if we just put some fixed hard rules down that we will behave to in our household, can we iron it out and make this transgender thing go away? Do you think that's possible, Marianne?
No to both, I have to say. Can we make somebody transgender? This isn't, I think we've got to agree that this isn't nurturing. I mean, I can only go off my own experience, both my own life experience and my experience of my clients in the therapy room. And, the world has taught them that this is wrong. The signals that they've picked up growing up is that this is wrong. So, and it doesn't matter what age they're at, everything before coming out has told them that this is wrong. So, whether it's a 6-year-old coming out or whether it's a 60-year-old, there's been nothing to encourage this at all. In fact, quite the opposite. So can we make them? by giving a friendly ear or saying that it's okay, what we're actually saying is you can discover what it means to you. Because I think that's always the question that people say to me, I think I might be transgender. And my first response really is, well, let's talk about what that means to you. And most people have never had the environment to actually talk about what it means to them. We have this fixated idea that it's transition, and it doesn't always need to be transition. Again, we move along that spectrum and we find our place on it. Can we stop being transgender? And again, no. We either are or we're not. I'm just going to temper that by saying, I think it's more, are we male or female, or are we man or woman? Are we who we feel we are? And the truth of the matter is, we are who we are, and we can no more change that than we can change our DNA. It's just who we are.
Yeah, I mean, you're completely right. And coming on from that, I've had people explain to me that, they were assigned male at birth. So everyone thought they were going to be a boy and a young man and an adult man. But it became very evident to them early on that this didn't sit right. And actually they were a girl. But they did not want it. They did not want to be transgender. So they tell me stories of how throughout their life they have tried everything. They have cut their hair, grown a beard. They've done the tattoos. They've done the bodybuilding. Lorry driver, beer swilling. You name it. Anything that possibly that they could do to reinforce the maleness, to kind of self-force their male identity. And then it comes to a point where actually, do you know what? It can't fight anymore. Just can't fight anymore. And the femaleness just has to be allowed to come out. And once it does, once that fight is over and the exploration of what it means for them to be a woman, even if they still have that kind of stubble on their chin or their tattoos on them or the slightly rounded beer belly type thing, it's just so important for them to explore what it is to be a woman to them and how they are going to fit now in their future society as a woman. I mean, and I'm not saying it's going to be an easy ride, but often when people have given up that initial fight and have decided to embrace this new way of living their identity, a lot of that dysphoria, that unhappiness that we talked about before, just falls away.
I think one of the most pleasurable sides of being a therapeutic counsellor, bear in mind we do sit through everybody's pain. So, to see real change in people, to see them move from that pain and start to flourish is a privilege. And I do get people that they turn up, whether I'm seeing them on Skype or whether I'm seeing them in the therapy room. I see this nervous person, many of them, they've never moved outside of the bedroom. It's been very private, very deep. And then over a period of a few weeks, sometimes a few months, they start and embrace who they are. And then when therapy finishes and you see them moving out into society, presenting as their true self. And I have to say, I'm talking more about transgender women here, and we shouldn't forget the trans men. There are definitely two different stories going on. But for the trans women, especially the older ones that have really repressed, and to see them start to flourish is one of the most pleasurable parts of my job, and one of the most privileged parts as well, for them to have shared that journey with me. I want to just go back to the trans men as well on this, because the interesting thing that I do find, the trans women have been very repressed with their presentation. And one of the things that we are seeing now, and I think you'll agree with me, that trans men and trans boys are becoming more visible now. And there's this idea that they've never been there before, that actually there's this kind of contagion. And I think it's the trans boys and trans men that have unnerved society a little bit. But the one thing that I have learned through the therapy room is that, a trans guy generally presented more masculine as a child, was able to express masculinity in a way that the trans woman couldn't. But actually saying it and admitting it is equally as difficult, despite the presentation. That actual saying those words and then the thought of coming out to other people and actually sharing it with them is equally difficult for both sets.
That's a really interesting concept, isn't it? Because we kind of have this picture that men just get on with it and they just manage and they don't suffer the same kind of turmoil that women have. And, we look at our trans men and we expect them maybe just to buck up and get on with it and, man up, as it was. But you're so right, the difficulties that they have to go through in their mind, in their body, in their families, in their world, in order to work out how best to fit in themselves and outside themselves are the same struggles. But I have to say, one thing is that I have found is, if you, and I say this to a lot of patients, is if you go out in the streets out there and you're walking up and down and you're looking at people, if there is an older transgender woman who has had to endure a full male puberty, there is no doubt that her features will have some masculinity to them. So maybe her hands will be bigger, maybe she'll have an Adam's apple, a deeper voice, maybe some stubble on her chin. All these things which identify her as a trans woman and kind of make it obvious that she's a trans woman as opposed to a cis woman. And, she has to bear that through all her life. And I've also seen the taunts and the pointing and the comments that she will have to endure, very sadly. On the flip side, for trans men, you don't see them. And you don't see them because once they've started testosterone as a medical treatment, we've switched their hormones from the female hormone, which is estrogen, to the male hormone, which is testosterone. And they go through a male puberty. Their voice will break, their Adam's apple will develop, their chin and beard will sprout, and walking down the street, they just mingle and meld, and they don't get that finger pointing and giggling behind your hand that I see trans women have to put up with. So in those terms, I think that they're luckier in some ways. And I think, we'll talk about children later on in the series, but that's why people presenting early, asking for help to stop puberty, is so important for the future. But I know, actually, Marianne, you have some thoughts on this whole idea of melding and passing or mixing into society, don't you?
Yes, in the therapy room, passing is always present in the conversation. So whether it's, somebody just right at the start of their journey or somebody that is partway through their journey, they talk about passing, that I can never go out of the house until I can pass, or when I start hormones, I'll get the changes and then I'll have the confidence because I'll be able to pass then. And passing really is probably, in the minds of most transgender people, the biggest block to moving forward. And I would say that that's trans men and trans women as well. This idea that they're going to feel judged, that when they step out onto the street, they'll go out there and everybody's going to see them for who they are, and that they'll never be able to get to that sweet spot where they can just step out and just go about the business. What I do see is, though, as they go through their journey, it actually starts to get less, especially in the therapy room, when they start becoming comfortable and accepting themselves for who they are, when they start to love the body for what it is. That I try to encourage clients to see their body just as the scaffolding, and that it's going to change. We can change the outside to a degree, and it can make them feel comfortable. But once they start getting that concept in their head and being accepting of who they are, then the talk of passing gets less and less. And I think the way I describe it is that, when we are comfortable in ourselves, that actually the people that we meet are comfortable with us. But if we're furtive, if we're guilty, if we go out there and we feel that we are not authentic and that we've no rights to be there, then people will treat us with suspicion. So part of the process, I find, passing isn't about how we look, it's about how we are and how accepting of ourselves we are.
You mentioned people living with us then, and I think, we've talked a lot about transgender people today. I think if we take that conversation further out, and we start to consider those people who are touched by the people we've been talking about. So we're talking about children of a transgender parent, siblings, brothers and sisters of a transgender brother or sister, parents, grandparents, What about in schools, in employment? So if you start talking about the wider world, we start to unpick a little bit about what this means to everybody. And surely everybody somewhere along the line has been touched by the issues that a transgender person face. And I see a lot of upset and tears and heart-wrenching and soul-searching when people are exploring their identity and exploring what the future holds for them, in terms of what does it mean for their children. I don't want you to call me daddy anymore. I want you to call me mummy. I'm sorry, I'm not your son. I know I've been your son all my life, but actually I've been wrong. I'm your daughter. These are difficult things, aren't they? We've seen people in very female-orientated jobs or female-orientated schools going forward and saying, I'm not, I'm a man. I know you think I've been a girl all this time, but I'm not, I'm a man. So, Marianne, what do you think about the concept? Are these people being selfish to their children, sisters, parents, grandparents? Are they being selfish in society, saying, I'm not just keeping this to myself anymore. I need you to make changes so that I can be encompassed more easily. Do you think people are being selfish there?
I think it would be really harsh to suggest that anybody going through any kind of questioning of their identity, whether we were talking transgender or any identity, are they being selfish by being true to themselves? And I would have to say no. I think what is selfish, if we're not careful, is to not be accepting of the journeys that the people are going on who are around us, the people that love us, because we talk about transitioning and we talk about trans men and trans women and we can get so focused on them that we forget that actually the ripple effect of this travels far and wide. And, when we come out, we get in this euphoric place, and we just think everybody's seeing it and is happy for us. And I think our family members in particular can start celebrating with us. And inside, they're breaking the hearts, because all the hopes, dreams and aspirations that our parents and loved ones have had for us are being blown apart. So I think it would be selfish to think that we're the only people involved. That would definitely feel selfish to me. Is it selfish to want to go and explore this and embrace it? No. But we've got to have an empathy for the people who are supporting us and who love us.
You're right. The first time that anybody is brave enough to bring the subject up is so important, isn't it? I'm going to tell you a story that someone told me, and this was an adult patient, so in their 40s, 50s, and they so clearly remember the time that they were at school, and it was circle time, and they were assigned male at birth, so sitting on the mat at school as dressed as a little boy and what have you, and they brought in an Indian lady, and she was showing the students about the clothes that they wear and the culture that they have. And she brought out this beautiful sari, and my patient was explaining the colours, the textures, the silks, and she brought out this beautiful sari and said, does anybody want to try the sari on? Would anyone like to see what it's like to wear a sari? And my patient's hand shot up, and it was like, me, choose me. And then that little boy that everyone thought was a little boy was just sat there and thought, oh no. And the whole class just dissolved into laughter and just started giggling and pointing, why would he want to dress in the sari? And so that person put away their gender feelings for years and years and years. That experience shocked them to the core and made it until they were in their 40s, 50s to bring it up again. And so it's so important, that first ripple that you were just talking about, the start of that ripple is so important. And we see it in medicine as well, I say to people, so how did you get on with your doctor? Have you talked to your GP about this? That first time when you're ready to go to your doctor and say, okay, this is going to sound a bit strange, or this might be a little bit difficult to understand, or I've been building up for a long time to say this, but I think I might be transgender, or I need to transition, or I need some help. And the reaction of that doctor is so important, because I've heard the stories of where they're like, oh, no, this isn't going to happen. I don't know anything about this. No, off you go. How can you possibly be a woman? You look just so much like a man. And then back that person goes into their bedroom, as you were talking about earlier, Marianne, and hides it all away back in the locked box under the bed for many years to come. So the first ripple is so important. And anybody out there who might ever have that first disclosure from someone, I think I might be trans. However you feel about it, however you think, I don't know anything about this, just, open your arms and get them, allow that space to talk. That's all that people are asking for.
I couldn't agree more, actually. You just reminded me talking then about I went to my GP twice, actually, because I went probably 10 years before I asked for a referral. And I think that's where I actually got the first set of counselling from. And I went in, and I remember sitting in the waiting room, and there was nothing in that waiting room to tell me that this was a safe space. And I was thinking, do I tell them, or do I say I've got an ear infection? I kind of had that escape route. And I went in, and I didn't know the words. That I'd never actually, apart from within my marriage, I'd never articulated this. And I remember going and sitting, my palms sweating. I'm sweating now talking about this, in the waiting room. And I got called through, and I sat down, and the doctor said to me, "So what can I do for you?" And I said, "I think I'm questioning my gender identity." And he said, "Right, and how can I help?" And I said, "I think I could do with some counselling." And he said, "Great." He said, "I can arrange some counselling for you." And actually, I came out of there, and I think his response was perfect. He didn't default to sending me to the gender clinic. He didn't start saying, "I don't know anything about this." His first words were, "How can I help?" And I think if every doctor could just say that and put the patient at ease to say exactly what they hope, then maybe some counselling would be the first spot. I'd chosen that, but maybe it isn't just about jumping up and down. I think when the doctor goes into meltdown, then the client closes up, if that makes sense. My second experience, I have to say, was pretty similar. I thought I'd have got used to it by that, 10 years further down the line. And yeah, it was, how can I help? But I was asking for a referral then, and he did everything that I didn't want him to do. He started telling me that he knows nothing about this and that he's going to have to go away and research. And I started thinking, oh my God, how serious is this? Am I going to get knocked back? But to be fair, he did what he said he was going to do, and he came back to me a week later with a phone call, and I got my referral. But that "how can I help" I think says a lot.
It brings in the concept, doesn't it, of that actually the patient is the expert. So although the doctor has the key to the next step, or the key to the medicine cabinet, or the key to the referral letter that's going to facilitate the counselling or the therapy that the patient needs, understanding that not everybody needs that. Everyone has different needs. So this idea that the patient, the person who has the identity issues, is the expert on this. And we talk about education, and you were talking about your second GP there, who was like holding his hands up saying, "I don't know anything about this, but I'm going to go and look it up." I mean, fair play to him. He went and looked it up, which is great. But education is there's such a key here, isn't it? I don't understand why it's such a scary topic. I don't understand why it's been left off the curriculum so much. But certainly when I was at medical school, this wasn't talked about. When I did my GP training, this wasn't talked about. It's not talked about in any postgraduate training. Even the specialist training for endocrinology doesn't talk about it. Psychiatry, it's not talked about. So in some ways, I feel sorry for my colleagues who don't have any experience or knowledge in this area, because the education is sorely lacking, and we need more. And that's where the community can come in and help, because they completely understand what it means to be transgender. And actually, they really help because they've done so much research. They know all about the hormones and the counselling and the referral process. But on the other hand, it's not their job to be the educator. So on the one hand, we must, defer to the lived experience of that person to help us understand what it means to be transgender to them. But we as healthcare professionals have a duty to then, if we don't know enough about it, go and read up about it now, just in case someone does come through your door and sits down and says, I think I'm questioning my gender. So education in society, schools, in the healthcare, in the workplace, in the government, in the army, education is key. And that's, it sounds cliche, but education is the key to the future.
I think something that you might be able to answer better than I can. I get a sense with the doctors, this is unusual in as much as generally when we go to the doctors, we're going to them as the expert. So whether it's a cold, a virus, or an ingrowing toenail or whatever, the doctor becomes the expert. And I think in this particular case, we're going in there and we're telling them something and we're not asking them. So, I'm not going in there saying, I'm transgender, what do you think? I'm going in there saying that I'm questioning my gender identity and I need some support from the gender clinic. But I think the doctor feels that they've got to have an opinion on it. I don't know if that's something, or am I just misreading that?
Yeah, you have to understand that doctors are a funny breed, if I may say such a generalist thing. But if you look back at 10, 20 years ago, there was the situation, if you went to your GP surgery, your GP was perhaps male, perhaps sitting in a suit at the other side of the table to you, and you would come in through the door and he'd perhaps be, rifling through your notes, and he may look up at you and go, yes, come and sit down, how can I help you? And you sat down opposite in kind of with terror or what have you, and there was a very didactic approach. But in more recent years, we've learnt to get the best out of your doctor-patient relationship, you don't sit facing each other, you sit side on. So now you'll notice when you go to your GP surgery, the doctor sits at one side of the table and then you perhaps sit at 90 degrees, so that there's not that confrontational power shift. And instead of, like you said with your examples, how can I help you? It's such a powerful word that doctors use these days, and that's what we're taught to do. Come in, sit down, you are welcome. How can I help you? And how can I help you with that? And, it shifts away from the doctor being the expert to the doctor being an expert in medicine, but how can he apply that knowledge to your particular situation? And can you, as an expert in you, help your doctor to guide you through the process that's going to apply a medicine to you, if that makes sense. And I hear from a lot of doctors who say to me, I've never met a transgender patient. I don't know what you're talking about. This is common. This is not common. We don't have any transgender patients in our surgery. I've never met a transgender patient. And I think to myself, and I often verbalize it, that have you never met one, or did your patient at the very last minute duck out and say, I've got an earache, instead of I'm questioning my gender? So, I defy any doctor who's seen a decent number of patients to have never met a transgender patient or person. They just don't know that they have.
So recently I was asked to talk at a conference of nurses in practice, and the brief was that they wanted to understand how they could make their practices more inclusive of diversity, in particular transgender. The first thing I asked them was, has anybody come across or met a transgender patient in their practice, in their day-to-day work? And 2/3 of them raised their hand to say no. And my response to that was, well, yes, you have. You just didn't know it. So what I then went on to say was, the question I would ask you is, why have they not felt safe to tell you? Because I know I sat in the GP's waiting room. I know I've been in a waiting room at a hospital. I know that I've been in environments where I'm coming across nurses, and I'm transgender, and I didn't always feel safe.
That's an interesting concept, isn't it, of safety that you left that last paragraph on, Marianne, because we should all feel safe, and no more than in a GP surgery or a hospital. We are supposed to feel safe in that situation, and yet so many of people don't feel safe. Whether we're talking about the debate about which sex ward a patient should go on, who should look after transgender patients, which toilets should they go in, what gender of chaperone should they have. But we all deserve to feel safe in our gender and in our hospitals and in our GP surgeries. And I think, next time we meet, I think we should really see if we can unpick what it means to get transgender healthcare for you, or for your family, or for someone who you love, or perhaps you're one of those people that's been affected by the ripple that we talked about before, and actually the ripples are really hurting. How do those people get support and help from our NHS healthcare system? So I'd really like to unpick some of that, how to feel safe, how to be safe, and how to provide safe care for these very exciting, rewarding and needy patient group. So let's really see if we can bash that out next time. Thank you. We hope you've enjoyed our programme. Do go ahead and subscribe if you haven't done so already. If you or anyone else are affected by any of the topics discussed in our podcast and you'd like to contact us, please drop us a line at doctor@gendergp.co.uk. We're very happy to accept ideas for future episodes and guests, or if there's something specific you'd like us to cover. You can also visit our website, www.gendergp.co.uk. You can follow us on social media @GenderGP, and you can sign up to our monthly newsletter. Full details can be found in the show notes on our podcast page. Thanks for listening.